Good morning and welcome to 5-Minute Monday Trends. It is Monday, February 7th, 2022. We'd love to welcome all of you back to campus today, and we're excited to go ahead and get going with our trends this morning. Dr. Bray, can you bring up our dashboard?
Absolutely. Good morning, Dani. So, Dani, as you can see, we continue on our downward trend here in North Texas. We have 53,000 new cases in the last 7 days, down from 59,000 the week before. And you may recall at the peak of Omicron, we were at close to 100,000 cases, new cases a week. So this is a really good improvement for us. We're down 10% from last week. And as promised, our active cases and now our deaths are starting to come down as well. Active cases are down 25%. Deaths are down 16%. It's still a highly contagious virus, but that virus has been through most of the people that are going to get it here in North Texas. You can still catch the Omicron variant of COVID. So by no means did the disease go away, but the big tranche of cases that comes from this highly infective disease has passed. So let's bring up the trend data and just show you what this trend is looking like here in North Texas. So very pronounced decrease in cases. The top left is active cases by date. As you can see here, we peaked in Texas at around at close to a little over close to 1 million active cases. We're now down quite substantially in Texas. We're around 650,000 active cases, and that trend would continue to be going down. The bottom right, we have our new cases, and again, our new cases have had a fairly steady decrease since our peak in mid-January. Let's take a look specifically at Dallas County, just as the bellwether. Again, the same trend. We're now almost to the patterns that we were seeing back in September for new cases in Dallas County. Dallas County's new cases on a given day are around 1,700. That pattern, by the way, holds for the rest of the 4 main counties in North Texas, for Collin and for Denton and for Tarrant. They're virtually identical graphs. So what we're seeing here is good news, continued decrease, and we need to, again, stay vigilant. Get with your healthcare provider about which vaccine is right for you, and make sure that you are still conscious, right? We've got to be careful about how we interact with each other to keep this downward trend going.
Thank you, Dr. Bray. And could you just touch on there's, some things in the news, I think it was South Africa, but some people are saying that they've hit a point where it's just livable. We're just going to live with COVID-19. Is that something that you think will happen in the United States, specifically in Texas? Or is there something like, I guess my question to you is, if there's more variants, right, are we just going to have to learn how to live with this in our country?
That's a great question, Dani. And remember, the general trend for most viruses is they become more infectious over time with each new variant, but they become less deadly over time with each new variant. So we see this, for instance, the parallel is the flu virus, the influenza virus. The influenza virus was extremely contagious and very deadly. It's now a seasonal flu. We have some seasons that are worse than others. We have a flu shot formulated each season based upon the strains that we think we're getting. Those of us who think we might be exposed, we go get flu shots, and it helps us weather. And then even if we get sick, which in COVID we were calling breakthrough infections, those conditions are much less severe than they would have been had we not been vaccinated. So I do think that that's the trend that we are on. That Omicron really showed us, what a highly virulent and not terribly severe infection wave would look like. We would probably expect to see future variants look like that.
Awesome. Well, thank you so much, Dr. Bray. As always, we will be back next Monday.
Thanks, Dani.